Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Dr. Sharfstein speaks to Dr. Celine Gounder, an infectious disease physician at New York University and a senior fellow and editor-at-large for public health at Kaiser Health News. They talk about shifting our focus in 2022 from COVID to a set of respiratory diseases, including COVID, influenza, and others. Let's listen.
Dr. Celine Gounder, thank you so much for joining me on Public Health on Call. You have been such an important voice throughout the pandemic, and now particularly talking about why 2022 may look different than 2021.
Well, thank you for having me, Josh. It's great to be here. I think we are in a very different place now in February of 2022 than we were early in the pandemic, than we were even a year ago. We have multiple highly effective and safe vaccines. About 2/3 of the population in the U.S. has now been fully vaccinated, and we're really seeing the benefits of that translated into our rates of hospitalization and death. The vast majority of people ending up in the hospital and dying from COVID are people who are still not yet vaccinated. At the same time, our vaccination rates have plateaued, and it's hard to say how much more headway we will make in the coming months. The SARS-CoV-2 virus is a virus that we also have come to realize cannot be eradicated or eliminated, and that's for a few different reasons. One, you have non-human hosts for this virus. And then secondly, this is such a highly infectious virus with such a short incubation period. Some of the strategies that were used to eradicate infections like smallpox, for example, are simply not going to be feasible. And when you look at the incubation period in particular, when you have a virus that has an incubation period that is faster than your memory immune response can kick in. So with Omicron, the incubation period's as short as 2 to 3 days, and your memory immune response can take at least 4 to 5 days to really kick in. It's very difficult with that kind of biology to really aim for elimination or eradication. So I think where we're at is we have some great tools, especially but not only including the vaccines, to control SARS-CoV-2. And so how do we move on with our lives in a way where we are truly living with COVID, but also moving on with our lives?
Right, because we're going to be stuck with COVID for a very long time.
Yeah, I don't think, I think, for the foreseeable future in our lifetime and our children's and our grandchildren's lifetime, yeah, COVID is going to be part of life. It'll be a bit like, other common cough, cold, flu viruses that we deal with. And it'll probably be the worst one, but it is something that we're going to have to figure out how to cope with.
Now, recently you have been laying out what coping with COVID really looks like. And I want to focus on one of the ideas that you brought up, which is not to put COVID entirely by itself in the spotlight, but to group COVID with other respiratory diseases. Could you talk a little bit more about what you meant by that?
Well, so there are a number of viral respiratory infections that have similar modes of transmission, for which similar mitigation measures will also have an impact. As we've seen over the last 2 years, actually, we've crushed transmission of the flu. And so by mitigating SARS-CoV-2, we can also have a tremendous impact on other viral respiratory infections.
And so that's sort of a interesting, maybe silver lining to all of the mitigation steps we've been taking for preventing COVID. But as you're thinking about the future and this new world we're in, you advise that we should be looking at their burden of these conditions together. What other respiratory diseases would you put in that bucket?
I think the most important other respiratory viral infections that I would put in that bucket would include influenza and RSV. Influenza and RSV both cause significant disease and even death in some cases, particularly in the elderly as well as in younger children. And before COVID, in really bad influenza and RSV years, we would see something like 35,000 hospitalizations a week and 3,000 deaths per week. And that's from influenza and RSV. And I think a lot of people would be surprised to hear that we had such a heavy burden just from those two viral respiratory infections even before COVID. We also know that influenza and RSV can trigger flare-ups of asthma, chronic obstructive pulmonary disease, which includes emphysema, in young children as well as in the elderly. And so you can prevent, by tackling these together, you can prevent not just COVID, but a significant amount of lung disease.
And so it's that they affect people in similar ways. Are these viruses also similar in how they're transmitted and can be prevented?
Yeah, that's right. So SARS-CoV-2, influenza, RSV, as well as other viral respiratory infections are similarly transmitted, either airborne, aerosolized, and in some cases also droplet-borne. And so many of the measures that we use to prevent transmission of SARS-CoV-2 also prevent transmission of these other viral respiratory infections. And in fact, we've seen over the last 2 years that we've really crushed the curve on influenza, on the flu, through the very same measures we use to control COVID.
So how do we do that? What are the implications of thinking of these diseases together? What does that change in the way we approach not just COVID control, but our life in general?
Well, I think it impacts how you think of what is the array of interventions and how you assess their effectiveness, their impact. So what are the different measures we're talking about? Many of these will be familiar to people. So, for example, masking or indoor air ventilation and air filtration. These are measures that will control COVID as well as influenza and RSV. So how might that impact you in your personal life? Well, just like the weather report will say, today it's going to rain, you take an umbrella with you. Maybe the weather report includes it's cough, cold, flu, and COVID season, and there's a lot of transmission. This is the time of year to wear a mask in the winter. And it's not just for those kinds of infections, by the way, that it might make sense to have that kind of advisory. There are parts of the country that deal with wildfire smoke. And so I think there's a whole host of reasons it would make sense to assess these things or to try to prevent these things in tandem. Other measures that we use to prevent SARS-CoV-2 infection or COVID disease is vaccination. We also use vaccination to prevent influenza. And so trying to pair our efforts to get people vaccinated, not just in the now, but ahead of cough, cold, flu, COVID season. And then you also have recently the scale up of rapid antigen tests in the home for COVID. And they also exist for flu. We just haven't been using them in over the counter. We've been using them in the ER or in the doctor's clinics or in the hospital. But to try to empower patients and people to care for themselves, to access treatment, just like with COVID, where we now have new pills, antiviral pills to treat COVID, namely Pfizer's Paxlovid drug and Merck's Molnupiravir. We, for a long time, have had oral medications for the flu. Unfortunately, very often, they are not taken in time to have an impact on the course of disease because the diagnosis is made too late, the prescription is given too late, somebody started on treatment too late. And again, to think of these sort of in tandem of it's cough, cold, flu, COVID season, I need to get a test for COVID and the flu. And if I am testing positive for either, to have an expedited process for people to access medications for both for free.
I see the logic here that if you're able to pair the responses or use one response that works for multiple pathogens, that even if COVID is going to be with us, maybe we'll be suffering less from some of these other viruses.
That's right. I think you're leveraging the systems that have been established in this crisis for COVID to also have an impact on other viral respiratory infections. It's not dissimilar to what's happened in the case of HIV in places like sub-Saharan Africa, where tremendous resources were invested to scale up programs, to scale up treatment, to figure out processes And why not expand all of that to address other viral respiratory infections that also cause a lot of disease and death and achieve efficiencies that way and really have a public health impact that way?
So here's a really important question, though, which I imagine people are wondering. What does this do to our data dashboard? Do we still have the COVID dashboard, or does it look different?
I think right now, our data on COVID is actually a lot better than it is for a lot of the other viral respiratory infections. I think this is really pointing out a gap in our data, that we don't do better surveillance for influenza, RSV, not to mention the many other viral respiratory infections. And so I think part of what would need to happen is also just better surveillance for all of them, which would also help us be better prepared for the next pandemic. We've always actually thought flu would be the cause of the next really big, scary pandemic. And I think bringing along work surveillance on these other viral respiratory infections along with what we're doing for COVID will really strengthen our preparedness.
I can appreciate the potential value of looking at these infections together, asking how many people are in the hospital for any one of these infections, how many cases do we have all told with these different infections, but there are also important differences between them. For example, I think the evidence seems to support that influenza is much more easily transmitted among children than, say, the SARS-CoV-2 is. Does that mean that we've still got to be tracking each one individually, or how do those differences play out in a respiratory disease strategy?
I think another place, in addition to schools, where you would have differences, Josh, is in hospitals. So how long is somebody going to be hospitalized if they have influenza versus RSV versus COVID is not going to be the same. So I do think you still want to be collecting data on each of them individually. You know, the amount of time of resource allocation with a hospitalization is going to be different. And so if you want to be modeling, predicting your workforce capacity and hospital bed needs, I think you do need that level of data. But at the same time, the interventions we're using to prevent, whether it's influenza or RSV or COVID, are essentially the same, with the one exception of the vaccines and the drugs that we use to treat these infections. All of the other mitigation measures are the same. And so do you really need to worry so much about distinguishing influenza versus COVID in deciding whether to recommend masks certain times of year or to upgrade your HVAC systems? I think what really matters at the end of the day is, are people getting sick? Are they ending up in the hospital? Are hospitals getting crushed from that overload? And are people dying? And I think regardless, you want to be looking at those kinds of measures in that setting.
So in this sense, the future maybe looks a little bit different. We're not going to be as obsessed with COVID. That is the good news in a way, but we may be tracking in a way we didn't prior to the pandemic, respiratory disease, and taking action to protect ourselves based on the big picture.
Yeah, and I think a lot of that also depends on what we do to buffer against this kind of transmission, viral respiratory disease transmission. If we decide to take indoor air quality as seriously in the 21st century as we did, for example, water quality in the 20th century, I think we may well have a tremendous impact on any number of viral respiratory infections, including COVID, influenza, and RSV. And will we need to be worrying so much about some of these individual level mitigation measures? Perhaps not, but I think it will require real investment in terms of those kinds of measures to get us to that point.
And presumably, we'd be in a better position if new respiratory diseases pop up.
Well, and I think that's the beauty of having this more holistic approach is these are measures, this is a mindset, a strategy that will shield us from other respiratory infections, some that have not yet emerged, and so we'll be better protected against those as well, as opposed to having strategies that are targeted at individual viruses. I think that becomes much more difficult and costly and much more effort if you're trying to prevent each of these individually, as opposed to figuring out what are the highest yield interventions that can really make an impact across the board.
Great. Well, Dr. Gounder, thank you so much for joining me today. It'll be interesting to watch how this year unfolds and hopefully get us to a place where all of this starts to fade a little bit more into the background.
It's great to be here. Thanks for having me, Josh.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McCusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.